I will call the Health and Human Services Committee of the Wayne County Commission to order. Welcome everybody to Zoom. Madam Clerk, would you take the roll, please?
Commissioner Marecki?
Here.
Commissioner Dobb?
Here.
Commissioner Anderson? You're muted. Commissioner Anderson?
Here.
Commissioner Baker McCormick? Oh, I didn't see her log on. Chair Colleen?
Present.
You have a quorum present.
Thank you, Madam Chair. Or Madam Chair, that would be me, sort of, kind of, in a way. Madam Clerk, item B on the agenda.
B, approval of the August 11th, 2020 meeting minutes.
Move approval.
Commissioner
Support,
Anderson.
Dobb.
Thank you, Commissioner Dobb. Is there any additions, corrections, changes to the minutes? Hearing none, all in favor of the motion, please say aye.
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 Opposed? Okay, let's go on to old business, Madam Clerk.
Old business, item 1, an ordinance by Commissioner Colleen to ensure the human and civil rights of all people are protected against discrimination of any kind in Wayne County by adding Chapter 55 to the Wayne County Code of Ordinances to be known as the Wayne County Human Rights Ordinance.
Thank you, Madam Clerk. And to committee members, we do have it finished up now. It was not ready for the agenda today. It will be on our next agenda in 2 weeks. We just got all the responses back yesterday, I believe, from the administration on the questions that were submitted by staff. So we will take it up 2 weeks for now, but for now we need a motion to pass it for the day.
So moved. Anderson.
Thank you.
I'll support, Dobb.
Thank you. All in favor of the pass for the day motion, please say aye.
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 Aye. Opposed? Abstentions? Okay, let's move on to new business, Madam Clerk.
Item D1, under new business, requesting commission approval of a 3-year agreement with 2 one-year options to renew with Health Emergency Medical Services.
Okay, this is for the WIC program. Who from administration has taken the lead on this?
Hi, this is Carol Osterberry from the Public Health Division.
Oh,
How are
hey,
you?
Carol, how are you today?
Good, good. So yes, this is for call center services, call center services for the WIC program. That is exactly correct.
Okay.
This was, go on.
3-year contract, correct?
Yes.
And that's what we've had in the past with them?
We had just had 1-year contracts. This actually went out through a full RFP, and that's why it's for the full for a 3-year.
Okay, you anticipated my next question. Commissioners, did Commissioner Baker McCormick join us yet?
She did
Okay.
not.
All right, for ease then, Commissioner Anderson, do you have any questions on this?
No, I'm good.
Commissioner Dobb, any questions?
No questions for me. Thank you.
All right, and Commissioner Marecki.
No, I'm all set too. Thank you.
Okay, Ms. Osterberry, what is the trajectory for people signing up for the WIC program, especially given these COVID times?
Commissioner Colleen, actually, because
No, I don't. That's why I was asking you.
really, when everything went into shutdown, I'm going to tell you, WIC was one of our quickest programs with the guidance and leadership of the state, and then our WIC program manager and then administrator. That program turned to remote, and those services were not ever, delayed at all for any of the WIC program, recipients, and they have been remote since March, whenever that was. And I will tell you, the staff all are able to conduct, through a lot of like Zoom or, meetings basically, and they meet with the clients and they renew, go through the whole analysis with the client and with the child and renew those benefits. That program has not missed a beat. Our turnaround time is very good. Someone new signing up is signed up and has their first appointment within 10 days. That program is one of my shining stars as far as just being able to really retool very, very quickly. So there were no delays or no interruptions in those services to our residents.
Well, that's excellent to hear because these are people on the edge that are receiving this benefit. Has the number of WIC participants gone up?
You know, I have not seen a recent number. I can tell you, though, that what has happened is that the participation, we also track number of clients, but then we track the number that are actively participating, making those appointments. That rate has gone up to over 90%, when we were more at about 80% were making their appointments. So we know we are reaching the residents.
Thank you. Any commissioner have questions?
Mr. Chair, I actually did
Please,
think of
Ms.
a
Dodd.
question.
Yeah,
Thank you.
Commissioner.
Carol, so you know, you're just speaking about how well the program went online and remote through. I'm sorry, I don't know if you said they were using Zoom or not, but
Yeah.
do you think that after the pandemic and you know, hopefully at some point we will return to normal, do you think that the WIC program will retain a portion of services to remote? I don't know if I'm wording that really well, but to keep meeting with clients online, it sounds like it's a little bit more efficient than having people meet in person.
Exactly. So, you know, my personal opinion and then my professional is many, many aspects of all of our lives are going to change permanently. And I have had that exact same thought that the WIC program, with how successful this is, there are times when, especially, you know, with that brand new baby, we want them to come in. But I would not be surprised at all if indeed there were new protocols for, you know, that client that has, you know, gotten on WIC, things are going well. Let's have that remote, you know, appointment rather than packing a baby up in the middle of winter, getting on a bus, or, you know, it's just, it is, yeah, you're
Yeah, if it's just a routine renewal and they just need to check in, then I would love to see that. Just,
I would too.
Let's just do that remote. Yeah.
Yep.
Okay. Great. Thank you.
Thanks.
Yeah, I think that's going to be a common question, Commissioner Dobb, when we come out the other side, what services we can continue.
Right.
Okay, any other questions on this? We have a proper motion and it has been supported. Any other questions?
Mr. Chair, Anderson.
Yes, Commissioner Anderson.
I had a quick question to Carol. Carol, could you tell me, have the hours changed at all at the Garden City testing location, those that are open to the public?
Ooh, not the fact that you're asking, I will have to double check as far as, now we're talking about the COVID testing, right? We're not talking about,
I'm sorry.
okay. Let me see if I can even have someone give me that while we're on the, you know, through the meeting today.
I'm specifically talking about the 2 hours that used to be reserved for Wayne County employees. If that has changed, or if now that's open to the public also.
Okay, I'm going to send a text message and maybe by the end of the meeting, I'll have that answer.
Thank you. Thank you.
You're welcome.
Yeah, and following up on that, Ms. Osterberry, if you have a comprehensive list of all of the testings in the county, who's doing them and where and under what circumstances, if you could forward that to the full commission as well. Not just this one, but if you have a complete list of who's doing testing when and what the rules are, please forward that. Okay, we have a motion. We have a second. We've asked questions. All those in favor of the motion for
I'm sorry,
item,
Commissioner, what was the motion for this?
I believe it was Commissioner Anderson with Commissioner Dobbs supporting. Somebody correct me if I didn't remember that correctly. Must have been it.
Yes, that's correct.
Oh, how about that? All right, that's my only one for the week. So we have a motion and a second. All in favor of the motion on item D1, please say aye.
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 Aye. Opposed? Are there any abstentions? All right, I'm going to guess item 2, D2, please, Madam Clerk.
Item 2, requesting commission approval of an agreement with the one-year option to renew with Brogan and Partners Advertising Consultants.
Okay, and I imagine this is going to be Ms. Osterberry again.
It's me again.
And if I remember correctly, Ms. Osterberry, we got a grant from the state of Michigan to do some educational stuff around medical marijuana. And this is the result of that funding that the state gave us?
That is correct.
You got more than that to say about this?
Yes, and I'm sorry, I was trying to get that text message off. Yes, so again, and it's all through statute under the medical marijuana, state law, that then this money comes back for community outreach education on medical marijuana. So for the, actually another year, we have gotten this funding, and we will be working with advertising firm and outreach on, making our messages a little bit different this year than we did last year. Last year it was more just that awareness. Now it's, what are the best practices? What can medical marijuana be used for? And also those same messages about the safe handling, safe storage, especially if you're in a home with small children. You don't want them getting into, the medical marijuana supply at home. All of those same things, and also making sure we're hitting our target audience. Especially with there are still those myths about taking medical marijuana when you're pregnant.
Mm-hmm. Okay, and these are dedicated dollars. They can only go to this project.
That is true. Correct, yes.
All right. We'll go around the horn for commissioners' questions. I don't see Commissioner Anderson, you're in the leadoff spot. Do you have questions on this item?
None right now. Thank you.
Commissioner Dobb, same question to you.
No questions, thank you.
And Commissioner Marecki.
All set. Thank you.
I don't believe we have Commissioner Baker McCormick. I keep looking for her name under participants. Join in, Commissioner Baker McCormick, if you're there. Okay, what's the pleasure of the committee on this item?
Move for approval.
Support.
Commissioner Anderson, that was Commissioner Marecki?
Yep.
Yep. All right, you got it, Madam Clerk?
Yep, got it.
All right. All those in favor of the motion on the floor, please say aye.
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 Aye. Opposed? Abstentions? All right, I guess we're on to item D3, Madam Clerk. What is that?
Item 3, requesting commission approval of Amendment 1 to a contract with the one-year option to renew with Global Vision Technologies.
Okay. We're back to our health officer with Ms. Osterberry for this, or?
No.
Oh, maybe Mr. Fqhc'S wants to.
Hi, it's Jennifer Caruso, clinical.
Oh, hey, Ms. Caruso, thank you.
Hi, good afternoon, everyone.
Yeah, what is this doing?
So Ebony McCann is on the line, and she will be responding to this Global Technologies item.
Okay. It's all about vendors and data. What is this going to actually do for us?
Good afternoon, Ebony McCann, Wayne County Adult Community Corrections Administrator. The department is requesting approval to enter into this contract with GVT. This system tracks and collects our enrollment data for community correction offenders who are receiving services. Our vendors utilize this system to enter demographic information as well as criminal history to assist with not only providing the service, but it also generates an invoice so that we can ensure efficient and effective billing.
Okay, and this is an amendment to the contract, correct? Yeah, Amendment 1.
That is correct. The system requires an update, and so the amendment will allow us to update the current codes to make the system more efficient.
Now, you mentioned services. Is this while folks are out in the community receiving services?
So a combination of both. Community correction programs initiate most inside of the jail. And there are also some aftercare services that take place in the community. So it's a combination of both.
Okay, very good. Thank you. Questions on this? I'm going to go in reverse order on this. Don't mean to scare you, Commissioner Marecki, but we'll put you up first.
No, I appreciate the explanation because I was wondering when I was reading the packet. So I appreciate that. Thank you.
All righty. Commissioner Dobb?
Thank you, Mr. Chair. How long have we contracted with this company, and how often do upgrades occur?
My apologies. I had difficulties getting myself off of mute.
Don't worry about it. We all understand, Ms. McCann, in this age. Everybody's beating the heck out of their computer screen trying to make something work.
Yeah, definitely difficult. It's my understanding that we have had this contract for at least 15 years. The contract is through juvenile justice, where community corrections is a sub-recipient of that, or sub-recipient of that contract. So, Commissioner, I believe we've had this contract for at least 15 years, but to my understanding, it has not been updated since. Is that correct, Sam? I think Sam Haddad is on the line as well, and it's my understanding that the system has not been updated.
Okay. All right. Thank you very much.
And Commissioner Dobb, I think we can also ask commission staff that did the work on this about the 15 years. They probably have the original date right at their fingertips without us going through 90 pages worth of stuff. Commission staff, do you have an answer for how long we have had this contract with Global Vision?
Hello, Committee Chair Colleen. This is Chris Albrecht, Policy Research and Analysis staff for the Wayne County Commission. I can look into that. For my search of records for the analysis, I only went back standard of 5 years, but I could look back further in our search of records in our county
we don't have
index.
We don't have to do it today, Mr. Albrecht, but if you could, and just send out to folks on the committee,
sure,
what you found.
No problem. I'll make a note. Absolutely.
Okay, thank you. I was wondering more if it was kind of if the updates were like a yearly thing, but it sounds like we haven't really had an update in 15 years. So this is yeah. Okay.
Right.
Great. Thank you.
Interesting photo, Mr. Albrecht.
Thank you.
Yeah. Maybe do a little touch up on the beard and mustache, but hey. Okay, and then Commissioner Anderson, you have questions on this?
No. No.
Okay. And I'm looking one more time. I hate to keep calling her name. Okay. All right, colleagues. What's the committee's desire on this item D3?
I'll move it, Marecki.
Thank you, Commissioner. And Commissioner Anderson supports. All right, proper motion and support. All in favor of item D3, please say aye.
Aye.
Aye. Opposed? Are there any abstentions? Okay. Item D4, Madam Clerk.
Item 4, requesting commission approval of Amendment 1 to a grant acceptance with the Michigan Department of Health and Human Services.
Okay. Who's from the administration is going to walk us through this one?
Hi, this is Carol again.
Well, yeah, Ms. Osterberry. So what does Amendment 1 do? What does Amendment 1 do? Yeah.
Right. This is giving us more funds for COVID response. Everything from hiring staff for contact tracing, case investigation, enforcement, to, yeah, and that's also got the, I think this is also, I'm just trying to read to make sure which one is in here. Yes.
Okay. You know, Ms. Osterberry, and we'll do it here live and in the committee. Not for the next committee, but for the one after that. And we're going to have a busy agenda 2 weeks from now, which I will discuss with the committee in a minute. So not for 2 weeks from now, but your little update on all things COVID,
Yes.
I think would be great a month from now, because then we'll have a month of school being open. Yeah, maybe things will look, or maybe they won't look different. Plus, I would imagine by then additional revenue. Lord only knows what Washington is going to do with what's promised to be a scaled down version of the next act with regards to COVID.
Right.
If you think in a month or so, if we can go back over this and really get into the contact tracing and all of the things that we're doing, and how successful we have been, or how successful we think. Okay.
Absolutely.
All right. We'll start with Commissioner Marecki. Do you have any questions, Commissioner, on this item?
So this is money that's just coming from the state, this grant money. It's not part of our COVID money, the 188 million, right?
You are right. You are correct. This
Okay.
is not CARES Act. I think technically it's CARES Act money, but it comes from Washington to the state of Michigan. State of Michigan then gets it down to the locals. But it is not part of the Wayne County CARES Act money that came directly from Washington to Wayne County. So you are correct.
Okay, thank you.
Okay, Commissioner Dobb, any questions on this?
I have no questions. Thank you.
All righty, Commissioner Anderson?
I have none, thank you.
All right, well, what's the pleasure of the committee on this one then?
I'll move approval. Daub.
Support Anderson.
All righty. Any other questions before we go to a vote? Hearing none, proper motion before us. All in favor, please say aye.
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 Opposed? Are there any abstentions? All right, I think item D5 is next on the hit list today. Madam Clerk?
Item 5, requesting commission approval of Amendment 3 to a 1-year grant agreement with the Michigan Department of Health and Human Services.
Oh,
Okay.
this is me again. This is right. And this is all part of that same, they just.
Ms. Osterberry, yeah.
Yes. Yes.
And this is that CPBC.
Right. The money is flowing through the CPBC contract is how this is working.
Mm-hmm. So this is the annual, this boosts us to over 12 million in that CBPC.
Correct.
Now, the state is on the same fiscal year we are, so we would expect in October to see a new CBPBC for next year, comprehensive. But they're adding to it for this year.
Correct.
Okay. All right, Commissioner Marecki, what you got?
So Carol, is there, like the CARES Act, we have to spend it all by December, the end of December. Is there any kind of limit on this, or it's just ongoing?
And that's a good question. Right. Some of this, and the way it came to us, earlier in the year, some ends on September 30th. Other of this money goes all the way through March 15th. And then as Commissioner Kling said, then we will have new money starting October 1st. And then that will go through the whole fiscal year. I think it's just the way the money came from Washington to the state. Yeah.
Okay. All right. Thank you.
Mm-hmm.
Thank you, Commissioner. Commissioner Dobb?
No questions. Thank you.
Okay, thank you. Commissioner Anderson?
No questions, thanks.
Okay. Well, what's the pleasure of the committee on this to bring additional grant dollars for
I'll
our
move approval, Marecki.
comprehensive? Thank you, Commissioner.
I'll support Daub.
Thank you. We have a motion and support proper. All in favor of the motion, please say aye.
Aye.
All opposed, please say nay. Are there any abstentions? Okay, coming down the list. Oh, good. E. coli comes into the conversation. What do we have for item number 6, Madam Clerk?
Item 6, requesting commission approval of Amendment 1 to an agreement with the one-year option to renew with RTI Laboratories.
Okay, but I see this is the 1-year option to renew and to pay invoices. Are we backed up a little bit? Are we doing additional testing this year? Or, well, let's let administration tell us
Right,
what-
yes. No, we aren't backed up. And as we said, this is, lakes,
Yeah.
beaches, Clean Michigan, and then the drinking water samples from private wells that are, out in Wayne County, far north and far south.
So how has our E. coli investigation gone with the water? What have we seen this year?
Right, this year there have been no instances of high levels of E. coli. We do still get those, we collected samples, and we also get reports from Grosse Pointe Farms, and nothing that was high.
I was going to say, we usually get some Clinton River coming down Lake St. Clair and then into the Detroit River and onward from there, but we haven't had any of that this year, huh?
No.
Oh, okay. All right. Commissioner Marecki, questions?
No, I don't have any questions. Thank you.
Thank you, Commissioner. Commissioner Dobb, any questions on this item?
No questions. Thank you.
And Commissioner Anderson.
None right now. Thank you.
Okay, checking my participant list real quick. All right, we have a proper motion and support. All in favor of the motion on item D6, please say aye.
Aye.
Aye. All opposed? Are there any abstentions? Okay, thank you.
Commissioner, there was no motion or support on that one.
I thought we did do that.
No, unfortunately, no.
Madam
No, I
Clerk?
thought, yeah, I thought I,
Yeah, it was
moved
No,
Commissioner
that was
Marecki
for
and then
5.
Commissioner Dobb.
That was for 5.
Oh, okay, 6, I'll
It
do it.
was? You didn't get anything, Madam Clerk?
No, I only got it for 5. I didn't get one for 6.
Okay, that vote never happened. Item B6, what's the pleasure of the committee?
I'll move it, Marecki.
Thank you.
I'll support Dub.
Yeah, okay. All in favor of the motion, please say aye.
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 Opposed? Abstentions? Hey, that might be a good thing. Vote on everything twice and see if people change their minds. All right, I believe then we're on item D7. Madam Clerk?
Item 7, requesting commission approval of 2 grant awards with the U.S. Department of Health and Human Services, Health Resources and Services Administration.
Grant awards for our Fqhc's. Boy, I hope this is new money coming in. Who from administration is handling this? Mr. Fqhc'S, is that you?
This is Brian on the
Oh, okay. Hey.
County Healthy Communities.
Yep.
This is a renewable award. Every 3 years, it's a competitive award. However, we're on the first year of the project period that goes to 2023. So this is our typical annual operating funds for the grants purposes.
Okay.
We do make a couple adjustments in this item, though. And I would love some direction from the commission of how to go about doing this in the best possible way.
Okay, that's a big mystery. What are you talking about, Mr. Midoff?
Okay. The first adjustment that needs to be made is about the 4th line from the bottom. It says June 20th. That needs to be changed to June 1st.
Okay.
Directly below that, it says account NOS. The 298, that needs to be fund number 221. Following that is 60520. That business unit needs to be 60521.
We can amend this so it goes properly to the full board with all the proper numbers. Commission staff, did you catch those changes?
Yeah, I wrote them down, yes.
You have them, Mr. Slezak?
Yeah, I do.
Okay, if you can double check with Mr. Midoff, maybe after the meeting to make sure we have all of that correct.
Okay.
It's easy to transpose numbers when you're just talking about it like this.
Okay.
Okay, and Mr. Midoff, would you please remind us again how Wayne County Healthy Communities has a little bit of a separation from Wayne County itself?
Absolutely. Wayne County Healthy Communities, at a technical term, we're a nonprofit entity. However, we are in a co-applicant cooperative agreement with Wayne County to execute the administration of these funds for the federally qualified health clinic. So HRSA puts the funds to Wayne County, and then through our cooperative agreement with Wayne County, those funds are spent for the operational purposes of the FQHC.
So in order to be a federally qualified health center, you need to have your own board?
Yes, that is correct.
And other requirements that the feds put on you?
Yes, that is correct.
Okay. Okay. Commissioner Marecki, questions here?
No, I'm all set. Thank you.
Alrighty, thank you. Commissioner Dobb?
So have the, I'm sorry if we already covered this. Have cities of Hamtramck and Wayne already received this funding?
These funds are to be drawn down by the county. So as the CFO of Wayne County Healthy Communities, I don't interact with those funds at all. That would be executed by Wayne County. So that answer would be better fielded by either Kamau or Ernestine.
Okay.
So this is Tom Coaches from Wayne County Healthy Communities. These funds are full regular grant funds, which will cover the operation of the clinic from 6/1 of 2020 to 5/31, 2021. The Fed fiscal year is different than the counties, and so it is a little bit, sometimes that gets a little confusing, but this will provide us our funding outside of everything else. This is our general funding for that full year. And I hope that answers Commissioner Dobb.
Yeah, okay. All right, thank you.
Yeah, and I would say, Commissioner Dobb, yeah, these dollars have not been pulled down yet because we're just approving them. But the county will pull these dollars down once we approve, and then it'll be allocated to healthy communities to do their thing. Somebody tell me if I did that wrong.
That sounds good, Commissioner Kleen.
Uh-oh. Commissioner Dobb, you still have the floor.
I'm all set now. Thank you.
All righty, Commissioner Anderson?
Mr. Chair, I was just calling or just asking, wanted to ask about this. It says Hamtramck and Wayne. Is that one located at the center on Howe Road and near Van Born?
This is located at Van Born and Vinoy in the public health building.
Right. Okay, Vinoy, I'm sorry. Mr. Chair, if it's in order, I'll make the motion to approve with the corrections that were mentioned.
Okay. Yeah, as stated earlier.
Support,
Thank you,
Marecki.
Thank you, and Commissioner Marecki supports. I have one other question, either for Mr. Midoff or Mr. Coaches. How does this compare to our previous grants? And how do the feds decide how much money they're going to send us for this? What's the conversation like between the healthy communities and the federal government in terms of what they need for the annual funding?
They base a lot of this funding off our uniform data report, which we send every year in February to HRSA. And they look at our volume, our quality indicators. As a matter of fact, within the next 30 to 45 days, you'll be receiving an update on this on our quality portion of the grant. But they take a basic look at the amount of clients we served during the last year and what we projected to serve when we wrote the grant. I believe this funding is up a little bit. Brian, was it about 3%, I believe, on our increase from prior year?
I believe you are correct.
I have to check that to be exact if you want the exact amount, but we did see a slight increase in our funding, and that we don't have a voice in the matter, really. Once we fill out the reports and send it on to them, they make that decision, and there's no appeal process with it.
Okay, so they decide kind of looking backwards based on encounter data.
That's correct.
Let me ask you this, Mr. Fqhc'S or Mr. Midoff. Does federal support for the Fqhc's kind of go on indefinitely, or is there you get support for the first 5 years and then you're on your own or something like that? And then also, as you're answering, if you could describe, please, how many people we are getting through the door in whatever measurement you have, number of individuals or number of services offered. What's the general trajectory for these clinics in terms of how many new folks we're bringing in? So it's a two-part question.
Yeah, Commissioner Kleen, I like to give exact amounts on those, so I'm going to give you a very subjective answer right now. And
that'll be fine, because the full report's coming in a couple of weeks.
Well, we can say that, yes. And I'm not going to vote twice, as you were referring to earlier.
All right.
But the fact of it is, our numbers are down a little bit with our visits right now, our primary care visits and our specialty visits, only because of the pandemic.
Yeah, you're not the only one, that's for sure.
We're not unique. Although our immunizations are starting to pick up here at the Hamtramck Center, because the schools are sending people in because they're, even some of the preschools or some of the private academies are demanding the immunizations again. And so we're starting to see a pickup in that. Obviously, we're doing our COVID-19 testing as well. And so we're working, and that keeps our volume coming in. In addition to that, it's now becoming flu season, and we're going to start to see some upbeats there, and we'll go on a flu campaign going forward. Our behavioral health visits during this whole thing have remained pretty stable, and that would make sense. We've actually brought on PhD clinical psychologists for our Wayne clinic, who's gotten up to speed very quickly at that clinic. So we're very pleased with that, and we're hoping we've turned it around. You know, we've increased our mental health services. We are also doing other things here to make the community aware of us. You know, a good example is our food distribution on the last Saturday of every month with Gleaners. And so people are learning to look to us in times of need, whether it be healthcare or some of their other food needs. And that great WIC program that was discussed earlier by Carol is also offered here. So even though it's virtual, we still get people coming in and asking us for the numbers and like to contact. And we're very pleased to do that. And so I guess the more important thing to me is we're now seen as a community resource. We are about to enhance putting in a dental clinic here in Hamtramck at the same time, which is well needed low-cost service for our community here.
Well, that's all good news, Mr. Fqhc'S, because these Fqhc's are important for the un- and underinsured in our community. We do like the occasional person to come through the door that does have insurance. But yeah, Fqhc's plug a very important hole out there for our citizens in terms of getting some services they may not otherwise receive. So,
Key
okay.
for us to get these people Medicaid, when we'll take the Medicaid reimbursement, and it's key to us to make sure that the Affordable Care Act remains in place.
Yep.
Get some of that insurance to us. So I'll leave.
Well, that's a discussion we should have at the table here. Just a little overview of the clinics at some point. You know, how many people are we running into that we sign up for expanded Medicaid? You know, those sorts of things. you're talking about having more of a reputation out there as a trusted member in the community. I think a few months down the road here, Mr. Fqhc'S, it'd be great if we can just get a general report on our Fqhc's, how successful they've been, who are we reaching, you know, the basic numbers here.
I'll work with Ms. Caruso, the county lead on this, to put that together and get it to you.
Yeah, let's think in the 2-month time frame, sir.
Sounds good.
With meetings only, you know, twice a month. All right.
Your inquiry for a number of patients.
Yeah.
Over the past 12 months, we've served over 2,000 patients, so about an average of 7,500 visits overall between those 2,000 patients.
Yeah, and then we won't get into it now, but I'd like to see last year, the year before. When we get into it in a couple of months, right? You know, are we jumping 10% every year? What the deal is? So we'll look at that down the road. We'll go to questions from commissioners, and Commissioner Marecki, we'll start with you.
I'm all set. Thank you.
All righty, Commissioner Dobb.
No questions, thank you.
All righty, Commissioner Anderson.
I'm all set.
Okay, what's the pleasure of the committee on this item then?
I'll move this item, Mr. Chair.
That'd be Commissioner Anderson.
Yes.
Support.
Commissioner Marecki supports. All in favor of item D7, the annual funding for our Fqhc's, please say aye.
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 Opposed? Any abstentions? All righty. Madam Clerk?
E, such other matters as may be properly submitted before the committee.
Well, I don't know how properly I'm submitting this, but I've already alluded to, you know, our next agenda is going to be a little bit busy. We are going to have the human rights ordinance before us to move on to the full board. We are also going to have the renewal of the contract for CCS or WellPath over in the jail. I'm going to get the analysis for that to commissioners well ahead of time so you can look that over. It was just yesterday in the back and forth of getting everything for this agenda that we did not have time, but I understand now we have administration's responses. So we'll get those out for people to see. And then also at the next meeting, I know we already have a log jam, our usual quarterly updates for our CMOs. Those 5 big contracts will be before us. So we'll have a little bit of a, and then probably the meeting after that, I'm talking with the department, and we're going to get a presentation on all things solid waste in Wayne County. We haven't gotten an update on that in a while. Wayne County is the home of landfills in Michigan. And so I want to get an update from the department on the county's role in solid waste. We do have a couple of committees within the county that deal with solid waste. And also there is some legislation introduced in Lansing. And I'm going to try to get one of the, not try, we're going to get one of the state reps that has written one of those bills and have a discussion of that, how the solid waste is changing in Michigan and the regulation of it. So there's a lot of things on solid waste, and I'm looking at a couple of meetings from now for that. So we're going to have some busy agendas in the foreseeable future here for the commission, for you commissioners. So I just wanted to make people a little bit of aware of that today, but look for information on the CCS WellPath contract to come to you a little early than we usually get for committee, so you have some time to digest that. I'm also going to include in that the Auditor General a couple of years ago, a year into what was then the CCS contract, did an audit. The audit wasn't exhaustive, but they did do an audit and pointed out some of the matters that were contractual in nature that we were supposed to get as a result of the contract, that not everything was happening at that time that should have. The audit helped it, but I think it's time to go back and look at that audit and say, okay, you know, how does this stack up with what's currently going on before we renew this contract? So lots to come next week. Does any commissioner have some such other matters that they would like to mention at this point?
Mr. Chair, I
Commissioner
don't
Murray?
have that, but the solid waste you're talking about, you're saying
Yeah.
that's probably going to be 4 weeks from today's meeting?
Yeah, not at our next meeting, but probably at the one after that. I want to give the department enough time. Mr. Cullen, I've already exchanged some emails with him over the last 3 weeks or so. And given people's, you know, just given how it is right now in the county, it was like, well, you've got a day job too, Patrick, so don't try to get this all to us in 10 days. Let's do a thoughtful presentation, you know, little maps, where are all the landfills, you know, how close are they to capacity? Are there any expansion plans going on out there? Just, you know, what's going on with our solid waste committee in the county, and what is the state looking at in terms of changing the regulatory environment here? So,
Well, I appreciate that, because Northville has a dump near them that's been giving
Yep.
them problems for years. So I would like to inform some of those citizens when we have this meeting.
yeah, and we will get, because lucky you also got one right across the county line that wafts over into Northville
it.
up there.
Yep, that's it.
So-
And they want to expand. So there's a lot of interested
Yep.
citizens.
And this stuff does not get enough public scrutiny quite often. It's one of these things that's buried in the bureaucracy, you know, and by the time people are like, whoa, wait a minute, well, you have an expanded landfill and trucks galore coming down your dirt roads to try to get in there while the kids are out playing softball or whatever they're doing. So yes, Commissioner, you'll be notified well in advance so you can get the word out as well.
Okay, thank you.
Any other
Mr.
commissioner
Chairman?
with some? Yeah. Oh, Mr.
I'm sorry.
Davis.
Yeah, I'm sorry. I wanted to kind of go over something real quick that I think you had directed when
Please
Carol
identify
Osterberg was on.
Mr. Candravis, so anybody
Sure.
watching.
Yeah, Andrew
this knows.
Candrevas from the Wayne County Executive Warren Evans office.
Thank you very much.
A question was asked, a request for, I think, Wayne County testing sites.
Yes.
And we've had this discussion in the past, where I just want to remind the members that it's all listed on our website, links to the MDHHS website, which
Right.
has an up-to-date, because they do change quite frequently, surprisingly,
Yeah, they
what
do.
are COVID testing sites. We do not compile a printed list. I think our communications had done it, and then they're just so outdated that I would always throw it back to them and say, hey guys, you missed this one's done,
Right.
you know? So is that an issue for members to get on that website? Do you want me to send that around again?
Yeah,
how do you
please send that
Mr. Chair?
around, because there you search by zip code or something.
Yeah, and I think you can do a whole county function. I think you can search
Yeah.
by whole county.
Well,
As
then
well.
commissioners can slice and dice it any way they want.
Yeah.
Whether it's just on their side of town, whether it's just in downriver, or if you want to get the whole county, commissioners can slice and dice that data any way they want.
Yeah, and I don't know if it's helpful for us too much. I haven't heard it, but you can even look in, in other counties. Some residents might be closer to a testing site, maybe in Monroe County or somewhere
Yeah,
else.
right. Yeah. Okay. Thanks for the reminder on that, Mr. Candrevas. I forgot that was the discussion earlier. But if you can just send around to every commissioner, hey, this is where you go. This is where all the data is for testing sites.
Sounds
Thank
good.
you, Mr. Candrevas. Yes. Anybody else with some such other matters?
Hi, this is Carol, and I did get the answer to the time for testing over at Garden City. And it is 7:30 a.m. until 2:30. And any Wayne County employees, when we come in, anytime during that time frame, then we get into like the fast lane, the Wayne County express lane for Wayne County employees. It was initially where it was just in the morning for Wayne County employees. Now the testing time is 7:30 to 2:30, and they have a short lane or a fast lane for Wayne County employees.
So that's 7 days a week or 5 or?
No, 5 days a week, Monday through Friday.
Okay. Thank you for that. Any other some such matters? All right. Do we have, did we get any emails? We're on to F, public comment. Did we get any emails of anyone that wanted public comment?
No emails.
Okay. Should we open the phones up?
Yes, I'm gonna unmute everybody.
Unmute people. If anyone out there that's attending this meeting remotely from the public would like to address the Wayne County Health and Human Services Committee, yeah, you got about 3 minutes to do that. We will take your testimony. We will not have conversations back and forth. Public comment is indeed that, where the public comes in to make a comment and not to start a discussion. Is there any member of the public that would like to have public comment at this point? Have we unmuted everybody so they have the opportunity if they would care to? We have?
Yes.
Okay. All right, so I'm going to make another call for public comment. Any member of the public listening in, zooming in with us today? And I will make one more call for public comment. I am a unicorn. Does that person have public comment?
No, that's Octavia.
Oh, yeah. Okay. I've got a cartoon for Octavia, then I just ran across a unicorn cartoon this morning. Okay, one last time. Any member of the public? All right. We will say no public comment today. The next item on the agenda is adjournment.
So moved.
All right. It's been moved, and hearing no objections, we stand adjourned. Thank you, everybody.
Thank you.
Thank you.